Hello, my name is Dr. Dom Colino of Back to Wellness Chiropractic. I've been in practice in Sheboygan for over 20 years. I specialize in utilizing the latest advancements in chiropractic techniques, including the Pro Adjuster, and as you'll see in a little bit, the Insight. Okay, so many times I've asked by new patients as to why should I consider chiropractic on a regular and systematic basis. And that answer really comes down to what's your objective? We have patients who utilize chiropractic on a regular basis to prevent degeneration. We have patients who utilize chiropractic to enhance overall performance in athletics. We have patients that utilize chiropractic to enhance their overall quality of life. The core premise of chiropractic is that when the spine is properly functioning, the nervous system also will function at a more optimal way. We will see more details on that in regards to a medical doctor study in a little bit. But for now, if we break it down to its simplest form, chiropractic seeks to identify areas of the spine that work properly or not, and what we do is we then adjust or manipulate those to get them functioning better. Simple little example of that is if each of these beads represents one of these bones, if each one moves properly, there's a little bit of motion that occurs between each. If there's an area of the spine that doesn't work properly, when you bend and twist and do what you do, that section doesn't move as well, but it causes the adjacent joints to move too much, stressing those out. What this looks like over time is eventually you go from an optimal, normal vertebra to a phase 1, a phase 2, and eventually a phase 3 degeneration. This is completely preventable with regular ongoing chiropractic care. Unfortunately, medical doctors often don't see it that way. What they will do is they'll notice a completely worn out joint and they'll consider that normal aging. Well, if you look in the x-ray, there's always a joint or 2 or 3 adjacent that's perfectly normal. So is that normal aging? Because they're all the same age. And my premise and chiropractic premise is no, that joint was unfortunately subluxated, fancy doctor word for what we fix as chiropractors, and it was left to its own devices for it to prematurely wear out. So what the spine does is essentially it houses the nervous system, which is in the back portion. And out of each between vertebra, there's a nerve, okay? And this is a very complex structure because it has to be able to move. And what often happens as a result of stress, be it physical stress, overworking, or not moving enough, or emotional stress, or chemical stress, it causes one of the bones of the body to not move as well as it should. When that occurs, it affects the nerve and its output and input to the central nervous system. That's what we refer to as a subluxation. So a subluxation normally causes this vertebra not to move as it should. In and of itself, that'll start to irritate the nervous system output and input to the brain. When that occurs, dis-ease results. And as you'll find out in a little bit, Dr. Wisner, the gentleman who did several hundred autopsies, discovered that chiropractic actually proves without a doubt that when these nerves do not function properly, people's overall health declines. What can also occur is as that disc slowly decompresses, the hole that that nerve lives in gets smaller. And eventually, when you get into phase 2 and phase 3, we start to see where that nerve is actually compressed. At this point, many patients call that a pinched nerve, which in fact it is. And it's a very serious situation. Does it not only produce pain, but it also negatively impacts the nervous system's ability to properly control you. So we're going to talk about the Dr. Windsor study. Who was he? He was actually a medical doctor who in the early 1900s was a bit concerned and confused that chiropractic was coming about and it was becoming a competitive healthcare industry. Chiropractors at the time had stated that when they adjusted patients, they improved their patients' overall health. Well, Dr. Windsor was curious as to whether or not this was true. So he did a series of autopsies, several hundred, and discovered, in fact, that when there is a subluxation in the spine, it did indeed cause dis-ease and eventually disease in the individual who suffered from that subluxation. Chiropractic today still utilizes manipulation to correct subluxations or lack of proper joint motion as described by Dr. Windsor's research all the way back in 1921. In our community, we have 8 chiropractors, and each of us utilizes a different technique or methodology. In my next video, I will describe what sets my particular practice apart from my competitors. Not that I'm better or worse, it's just different. And hopefully by you seeing the next video will give you a better idea that there doesn't necessarily have to be the forceful manipulation that many often associate with chiropractic adjustments. Thank you.